Hey everyone, this is Hannah. I'm bringing you today's Rocket Miner COVID-19 update. Today for Wyoming, we're up to 166 confirmed cases of COVID-19. This is up 13 from where we were at yesterday and includes the first case in Lincoln County. Last night, the governor shared that 37 people have recovered so far. And today, the Sweetwater County COVID-19 Emergency Operations Center included in their status report the note that while Wyoming's case count ranks among the smallest in the U.S., the state's per capita total outpaces more than a dozen other states. But Wyoming remains the only state without a known death of a coronavirus patient. So again, there are so many things to keep in mind when you're hearing numbers and statistics. And one of those things is that even though our number is lower than so many states, we also have a smaller population than most states. So just keep those things in mind, the different factors that can affect what those numbers actually mean. The EOC also noted today that the first confirmed positive Sweetwater County patient is now fully recovered and has returned to work. So that's great that that man is doing well now and going back to normal. The other two confirmed positive cases in Sweetwater County are both still doing well. They just have mild symptoms and they're treating those from home. Today, Governor Mark Gordon and State Health Officer Alexia Harrist announced that they're extending the 3 existing statewide health orders through April 30th in order to slow community transmission of coronavirus and to protect lives. They said that specifically the current orders that are closing public places, including schools, that are prohibiting gatherings of 10 people or more, and that are closing bars, restaurants, coffee shops, and personal services, all of those orders that they already had in place are just being extended again through the end of the month. Governor Gordon said the decision to extend these orders was made to save lives and to keep people at home. Again, he's still trying to keep from having to order a shelter-in-place order for Wyoming, but just doing as much as possible to encourage everyone to stay home, don't go out, don't keep spreading this virus. The governor also issued a directive requiring any individual who's coming to Wyoming from another state or country for non-work related purpose to immediately self-quarantine for 14 days. Travel is one of the biggest ways this virus gets spread, so he's taking precautions for people who are coming into the state from out of state so that they don't bring more cases of the virus into Wyoming. Along with the governor's order, the city of Green River announced that the extension of the closures to the end of the month, they're complying with that as far as all of the city buildings go. They're extending the closure of city buildings to the public until further notice, but they're working on keeping all their offices open as far as having people there work remotely so that they can still answer phone calls, answer emails and questions, and they're constantly updating their website and Facebook page, so they're keeping up with things as much as they can while keeping the buildings closed. State health officials also recently announced that the state's public health laboratory is going to have to limit the samples that it tests for COVID-19. Dr. Alexia Harrist, the state's health officer, announced that the laboratory will only be able to test samples from high priority patients, healthcare workers, and first responders. She said that this decision is designed to preserve the supply of testing materials available to the lab. So just because of the limits that they have on the tests that they're able to do, they want to really focus on using those effectively. Harris said for the time being, testing is going to be limited to samples from the following types of patients. So there's healthcare workers, first responders, hospitalized patients, patients or staff in facilities such as nursing homes, people over 65 with underlying health conditions, people who have had close contact with them, and pregnant women. So they're focusing on keeping the tests, giving people higher priority that are more at risk from the virus. This doesn't mean that other people can't be tested. Harris recommended that samples from other patients who don't fall into these categories be sent to private commercial laboratories. So you can still be tested, but again, just the best thing to do is if you feel sick at all, no matter what you think it is, stay home. All of us should be staying home anyways, but especially if you are sick, quarantine yourself and your family. Don't go out, don't spread it. The Emergency Operations Center also said in their statement today that they're going to be taking a little bit of a break over the next week. They said, in an effort not to inundate the public with unnecessary, non-critical, or repetitive information, and not to overwhelm or exhaust those serving the Emergency Operations Center this early in the game, so to say, absent exigency or any critically relevant local updates, the Emergency Operations has opted to recess from official operations over the coming weekend. So they're just stepping back a little bit. They'll still give the most important updates, but they're not going to do their daily status reports they've been doing just for the next week to kind of give everyone a little bit of a break. They said in the statement, while we all struggle to meet the challenges of navigating this new reality, sadly, slowing the spread of the COVID-19 virus both locally and globally represents a marathon, not a sprint. We are confident that if we all continue to do our part by following all current guidelines and recommendations, particularly as they relate to social and physical distancing, we are in good hands here in Sweetwater County, and we will all get through this crisis together. As far as the rocket miner goes, I just wanted to note that we are continuing to do our best to keep you informed, to give you good, reliable, credible information, and we are working to find a balance between the positive stories and the more negative stories, the more serious sides of this and the things that we can all look at to be encouraged by. Sometimes we share stories in the newspaper or on our social media, and we get different comments on them from a lot of different people who agree with them or don't, and some of those comments question why we're sharing certain stories or certain information. This morning, for example, we shared a story that came from WyoFile. It had the headline, New Model Predicts Wyo COVID-19 Deaths, ICU Shortages. And it shared some different statistics that were coming from a statistical model used by a University of Washington researcher. So this person did this research, charted out this graph that was predicting how many deaths we'll have, just different ways that this virus will affect Wyoming over the next few months. And those numbers were scary, admittedly, to look at. Those statistics were scary. And somebody commented and asked, why are you sharing such negative things on Facebook? And other people commented and like, well, these numbers don't mean anything. They're just projections. They're just trying to figure out what's going to happen. That doesn't mean it's going to happen. And that's true. That's absolutely accurate. And lots of people were saying in the comments, we really hope this isn't true. We hope these numbers aren't accurate. And I agree with that. I definitely hope that we don't have as many deaths as that model was predicting that we would have. But we still shared it on our Facebook page and on our website because it's our job to report what people are saying about these things. That was, as I said, from a model used by a University of Washington researcher. It's scientists, it's people who are trying to make predictions, who are trying to figure out how to handle this information. And during a time like this, when there's so much uncertainty, it can be hard to know who to listen to. So we try to find the most credible sources to give you from health professionals and from really smart people who know what they're talking about and who know a lot and are studying this virus. But we're all still learning about it together. We're all still figuring out what it means for us. But as a newspaper, we try to share a variety of opinions and sources. Lots of our stories come from other Wyoming newspapers, so we keep you informed about what's happening throughout the state. We share Associated Press stories that are national or world news that are different perspectives. And these stories will come with a variety of opinions and biases and perspectives on things. And if a newspaper is doing its job, it's like a library where there's always going to be something in it that's going to offend somebody. Because we have to share all of the different points of view, we want to be able to share multiple perspectives. And that's important. It's important for us to be able to listen to opinions of people that we don't agree with. It's important to look at statistics that are a little bit scary so that we can understand the seriousness of this situation. But we're never sharing things to outrightly offend people. And when we share things, we're not saying that we as a newspaper agree with it either. We're sharing all the opinions, all the different sources and perspectives. And we're human beings too. We look at those stories and all the different people in our newsroom may have a different perspective on that story and what it's saying. We might look at that headline and take it with a grain of salt. We're people, we have our own perspectives and opinions, but as a newspaper, we're just doing our best to keep sharing multiple perspectives with you. And we are trying very hard to not just sensationalize things, not focus on the negative, not overwhelm you with all of these numbers and depressing statistics and sad stories. We don't want to do that because we're part of your community, we care about you, we care about people's mental health, and we understand we don't want you to be overwhelmed or panicked or scared. We're just sharing information so that you can make smart choices and make decisions based on the information. We're also working to keep sharing positive stories about the awesome things that our community members are doing. And we hope that as we keep trying to find that balance and keep you informed, as our job is, that you would understand that that's where we're coming from. We're coming out of a place of caring about you and wanting to do the best we can. So thank you for listening to all of our updates. We will keep sharing information. We'll keep doing these daily videos and keep you updated on the situation as it changes. And we hope to keep encouraging you too. Have a good night.